Jennifer has a left CVA, right? So typically what will happen if I get her up to the side of the bed, she's just going to leave that left upper extremity right there. Okay, and what happens? And you just leave it right there, okay? So I'm getting her up, and then if I do this and get her up there, I mean, she will just, this is laying here and she's sitting on it, you know, she's not really attending to it. It's difficult because she can't move it, right? So we have to take care of that for her, or him, okay? So again, if she lies down, she has a left CVA, we just put it right there. You know, we can use the same principles of a log roll because that works. You know, it's not necessarily for protecting her back, but it's still helpful. Okay? Yes, Arnold.
You said left CVA. Shouldn't she have right hemiparesis or no?
Well, I'm just saying left hemiparesis.
Left hemiparesis.
Yeah, sorry.
Right.
Okay, so when I roll her here, now it's protected. Okay, because she has mobility with this right hand, and then I ask her to bring her legs off, and then I say, Jennifer, push up with your right hand to the edge of the bed. Boom. And then it's here. It's protected. Okay? You guys get that? Questions about that? Okay. She has a now right hemiparesis. Okay? Go ahead and lie down again. So now here she has a risk of, if I do that same thing and I don't attend to it, she's going to crush her right hand. Right? 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 Yeah. Oh, I did that. Sorry.
No, I didn't.
So again, you can just place it right here, okay, and then she can roll over with that left hand, right? Good. And see, it's in a nice place. You know, now it's out of the way, and then she can legs up, and then you help her push because it's difficult to push off with the opposite hand off the bed. Okay? Does that make sense? Okay. For this bed mobility for somebody who has a stroke is that even though they're in bed, you're making sure to address that upper extremity. Okay? That's our job. Okay? Yes, Sarah?
Do you have a preference of which way, like should they roll on their good side or their bad side?
No. Left knee replaced. Go ahead and lie down. Okay? Mary Grace, go ahead and sit up to the edge of the bed. Bring her. Come on. They usually, you know what? I just wanted to do that to illustrate a point. She's playing. They usually can bring that left knee or right knee right off the bed right away. Okay, but in the event that they can't because they're in excruciating pain, you know, you're gonna help unweight that lower extremity. Okay, so let's redo that. Okay, so if I'm here, right, and she had a left knee replacement, am I just gonna do this? Hey, what's on ESPN?
Oh my God!
What's on ESPN? Am I gonna do that? Oh no, because she's gonna be contracting her quads, and she's in already 8 or 9 out of 10 pain. Okay, and this I had to do this today because, you know, even right now, week 12 with my interns, they made that little mistake. So what I want them to do is I want them to look at I want you to look at your patient's face because you're going to see the reaction, you know, right? You're going to want to handle this with a lot of TLC, and then you're going to say, okay, get up to the edge of the bed. I'm going to help you with this leg. Okay, here. You're supporting. Okay, wait. So stop right here real quick. Okay, now, right here, should I just do this? No. Because you can imagine the contraction in the quad. They cannot control this. Okay? The, what is that? The eccentric control of that leg coming down. Okay? So what you want to do is you want to make sure you just bring it down and then you just help lower it slowly. Okay? Remember, we're the good cop. Okay? The PTs are going to get this patient, bring them into the gym, and they're just going to be, okay. Hey, what's happening? Are you going to do that? No, you're not going to do that. Okay. Now, what's important here is you're going to help Sarah maintain her total hip precautions, which are what?
Bending and twisting.
No bending past 90 degrees. Okay. No internal rotation and no crossing of the legs. Okay, so I'm not gonna come in here. I'm looking at Sarah, by the way. I'm not gonna go, oh, log roll. No, no. Okay, I'm gonna just help her
90, right?
again
Is that what
unweight
she said?
her lower extremity as she comes off the bed because all her body parts move. This is the operated leg. This is the one 9 out of 10 pain. You're gonna help her come to the edge of the bed. So you just help unweight. And you know the optimal place where you're gonna position your hand for a knee patient or somebody with a hip replacement is right underneath the calf. Okay, right there. Sarah, can you sit up at the edge of the bed, please? And then here, here you can release because there's no issue with contraction at the quad, okay, because it was her hip. Her hip here is fully supported by the bed. Okay, you guys can see that, right?
Mm-hmm.
So you can kind of release her leg, it's okay. All right? Questions about that? Trochanteric slide, say that 3 times really fast. I am going, Mike, let's get up to the edge of the bed. So slowly, I'm going to just slide it off, okay? And then here, you're not worried about the knee, but you just slide that lower extremity off the bed. Okay?
Don't let go of the hips and shoulders in line with each other. Okay, first, lift, bottom.
Should I hold that up for you?
Okay, good.
Yeah. I'll
Okay,
do
so,
that.
Can you say it step by step?
okay, log roll. Okay. Okay, I'm gonna tap. Okay, all right. Okay. She's bend the knees. Okay, I'm gonna lift you over to the side.
Up, stop.
Is this a spinal cord patient?
Spinal cord injury patient, log roll.
Oh, that's right. Okay.
Okay, bend the
So,
knees.
bend the knees, right?
Yes,
Okay, so
more.
I'm gonna more.
Perfect.
Okay.
Okay, now.
Then I'm gonna
Yes.
pull her towards this way so don't fall off. Ah. Okay. Am I holding her here?
Yes, that's fine. Yes.
Okay, here we go. I'm gonna roll you over. Oh, shoot. Okay. Okay.
Good. Perfect.
All right, there we go.
Next.
And then I'm going to lift her legs and then put them on the ground. So while holding her here.
Slide her legs off.
Slide her legs off. Okay.
Good. Okay.
Okay.
Okay. One hand there.
One hand here.
Oh,
Uh-huh.
yeah.
Okay. One
Okay.
hand
All
underneath
at-
the shoulder.
All at once.
Right there.
Go up. Okay.
Okay.
Here
Okay,
we go.
good.
Okay.
And then.
And then push her down and then lift up.
Yay!
This is complete.
Yeah, complete spinal cord injury, quadriplegic. Okay?
Okay, so then lean them forward.
Yes. Yes.
Oh, it's so hard.
Oh yeah, Alicia. Slam dunk.
Get him.
A lot wider. I mean, here I can grab to the side. I want to get her over her feet, which is the most important piece. Okay? So you're not going to be able to do that with somebody who's a little bit wider, so then I would widen the grip here. Okay? And then it would be closer to the buttocks, you know, on the back. It's more difficult. Yeah, however you feel comfortable. That I've log rolled Mary Grace to the edge of the bed. Okay, so now I'm going to position the sliding board here. Okay. And remember, you guys want to make sure that you get it underneath most of the bottom or underneath most of the thigh. Because what happens then, once you start sliding Mary Grace or your patient off, this is going to just pop right out. Okay? So again, this is going to be a sliding board with assist. So you're going to unweight and you're just going to slide her over. Slide her over. Okay? And then finish. Slide her over. Okay? And then you're going to lean her.
But we're assisting, so the patient
Yeah.
should be doing
Here. Okay. And then I'm here. So I unweight, get her on her feet, and then slide. Reposition my feet, and then slide.
Mechanics
Just run
of the
through it.
to stand. For
Extension
CPR.
anterior, pelvic tilt. Flexion
Hip
at the
flexion.
hips. And then move the weight forward.
So what happens with the hip flexion?
The femur goes over the tibia.
Good.
And then
Lean forward.
and stand.
Okay. Good.
Did I miss anything?
Yeah. Nope.
Okay.
Alicia has right hemiparesis.
Sit to stand from the side.
Yeah. Okay.
And
Okay.
do the nose way.
Okay, so slump. And give her trunk extension. Okay. Here. We come forward and then we lift here. Oh, I didn't do that nicely.
No.
Come on.
I didn't like that.
No, I didn't do that nicely at all. Wow. Sorry, guys. Okay. So trunk extension. Okay, hip flexion. Here. That's better. Better.
Yeah, that was a good one.
You know
Now
why?
I can brush.
You know why? It's because I shot you over your left foot and I was keeping you behind.
Okay.
And you're going to transfer them to the left here, and I'm going to facilitate here. I'm going to be around both of Alicia's knees. I'm going to get her over her feet and then just transfer her. Okay, she doesn't get up to full stand during that time. I just get her bottom unweighted. Maybe she's off the surface about 20%. Okay?
Partial stand
Paul, when
pivot.
you're doing this for CBA, you're facilitating too. You're doing NDT, right? When you're doing this, are you doing
Yeah,
like trunk
yeah. So
extension?
here's my NDT. So I'm back here, and I give her trunk
Yeah.
extension. Okay, and then I'm getting her over her feet.
Hands are arm rest.
And slump. So I do this. Okay. That's it. So if I give her external rotation, it's going to promote trunk extension, right? Because there's a deduction of the scap.
Ah.
Okay, she has right hemiparesis. I'm around her knee. I'm not blocking her knee. I'm not one of those aides that works in a SNF. I'm blocking her knee because she won't be able to get up, right? Remember we did that one exercise? Remember that long time ago? Where we blocked each other's knees and how difficult it was to get up? Okay? So here I'm around her knee, so I'm allowing her femur to come up. And then I get her up. And then I ask her to step to the chair. Good. And then we are down. Okay?